those soft tissues to release as I'm retraining that movement of external and internal rotation at her hip sockets. All right.
You know the price has gone up to $200.
As well it should. All right. And I'm pretty happy now with what that's looking like. We said she's, did I say a flux or something?
The coccyx?
Yeah, right.
It was more of a right rotation with the dominant. Then she undulated.
Yeah.
You said it's.
Yeah, because it should be, and I'm a little too high up there.
What's your comparable sign? What are you gonna retest after this?
Functional manual therapy,
The test
the
and.
testing. And I could do it just after doing this. Well, we can do that. Usually people have a pretty significant, usually like a 1 grade jump.
Okay.
So, do we want to? Anyone? Anyone? Okay, we'll do it. Just for the fun of it. Okay. You all right? Okay, stand back up, please. It was with the right leg there was a 0, so that may or may not change that much. So step forward with the right leg. Good. Don't let me push you over. That's pretty better. Hold on, let me move you. She still falls back, but not as much. And we don't need to test this one because I was already a 5. Switch to the other leg. Hold on 1 second, because you just settled yourself. That's okay. So just step forward and stop. There you go. Don't let me push you. That's significant difference. Hold on, let me move you. And that's significant difference. Okay. So from a
Which
functional.
side were you treating? More the right side? On the coccyx?
Yes, right side
Okay.
coccyx and left side sacrum at the same time. Okay. So.
The treated dysfunction on the right side seemed to make the right side much better.
And seem to be able to, if you think about it from a functional standpoint, that right side, when I'm pushing her back onto it, is accepting my load and her load of her body, right? So if you're, and it doesn't necessarily work like this all the time, right side, left side. Again, you treat the dysfunction that you find, and then you retest for function afterwards. Okay, let's go face down again. All right, now, if she's a thin person, she's frail, she's afraid of me moving her, am I working this hard on her? No. If she's a big guy who, like Tony, this guy this week, who's transferred from another therapist to me, who's mouthy, I tell him, shut up, get on the table, and I start beating on him. He's like, oh, and he's making fun of my shirt. Whoa, what'd you get? It was a funny looking shirt, right? I wear funny clothes sometimes. And he, anyway, he was making fun of my shirt.
The ruffles.
The ruffles shirt. Okay, so now I'm looking at, for the sacrum. So it looks like I'm doing hip internal and external rotation, which I am, but that's not where my brain is and that's not where my focus is. My focus is I need to do sacral, left side, nutation, and counter nutation. And I'm just loading it up, so I'm not just doing this. Because that's what you do when you're a student, and you're supposed to, because you're still trying to learn, right? And you're trying to figure out what is this feeling? Like, am I doing anything? And when you get to be you lift up a little bit more experienced, then relax that down. Good. Now I'm going to block the innominate, get on that sacral piece that I want, pisiform. The rest of my hand is going to cover it. It's not doing anything. Pisiform here. And then, what do I need this hip to do? What can't it do on the board? It can't do external rotation at the innominate, so I think that's what I'm going to go do. Just to block it, help it move, right? Going into the restriction, very specifically, right? This needs to move forward so that this can rotate back. Move forward, rotate back. Hey, patient, can you move, please? So, she's like, nope, I can't. How about this? You can feel my leg right here? Can you just push into my leg? And then release. And push. Good, and release. Is that too hard? I'm pushing pretty good, you can see. Push. Good, and release. Good. Try and straighten your knee now. There you go, and release. Try and straighten it. Good, and straighten it. Excellent. Now I'm going to do counter nutation. Wait a minute, but you were just nutating it. It can't have both. It sure can. Think about a door, right? The door is stuck. It can't close. It also can't open. So I'm not going to just work on it closing. I'm not going to just work on it opening. I'm going to do both. Sacrums need to be able to nutate and counter nutate, so I work both. That to me was a very hard concept when I first started treating. But if I need this, then I can't do that. right? Does that make sense? But a couple of you are staring at me going, but wait a minute. Try it. See what you think. All right, from here, push into my handle, let me move you. So again, I'm doing sacrum, PA glide on the left side to do counter nutation right now because I'm at the ILA. Push. No, not here. Push into my hand. There you go. Come on, push that. There we go. And release. Good. And push again. Good. And push again. Good. And relax. Excellent. Now we're getting a good histamine response. Just make sure that that's looking good, which it is. All right. Other things that are popping into my head are that I really want to do some femoral work, but am I missing anything else? Okay. So I can do an AP glide, which is probably going to do better for her than doing inferior first, because I want to get her on axis before I start moving it inside the socket. So I want to get her femurs backwards, in particular her right side. So can you lie on your back, please?
If I already checked the LPM on that one,
Yeah, sure.
on the left side back.
Yeah, you want to stand up again?
The right side back was much better after the coccyx work, the left side.
Okay, stand forward with your right leg. Good, don't let me push you over. Ooh. Hold on, let me move you. And see, I'm coming on even quicker now, and she has a response. I still overpower her because she's not strong, but she has initiation, right? Initiation, strength, and endurance. We finally have it to initiate. Great. Lie under. Yeah. I just said I'm going to do AP glide. So here's where we kind of get into a little pickle when you're demonstrating. She's got a lot more soft tissue issue than I think she has joint issue, which is what is creating this dysfunction. But inferior and slightly posterior glide here. Is that okay? Mm-hmm. That's where your water ski techniques come in really handy. Ever so slightly, take your pubic bone, wherever you think that is, and pull it up towards your nose. Perfect. And then one more. Good, pubic bone up. Good, relax your left side a little bit. Okay, relax that.
Drawing her pubic bone up allows her to set the spine, makes it a little more stable, and allows the thrust to be more at the hip rather than through the spine.
That's about 50%. I'm not that excited about that. I'm not that impressed with myself about that. All right, let's do this one because I know that was the much more restricted one. Actually, Bob, do you mind helping me out on this one?
Yeah. Like,
So there's different end feels, right? If you have a soft tissue end feel or a joint end feel, you can just do a slight distraction.
tell me direction.
Compress it instead. And her right hip feels like it gets even tighter, which is kind of is intuitive. Like, yes, if I lengthen something, it's going to feel tighter. Her body doesn't respond well to that up here, so I want Bob to actually compress the joint and give it some space so it can unravel itself, and then allow that joint to do what we want it to later. So I'm going to push the femur posterior.
Screen there.
So my left hand right here is gathering some of her tissues and pulling them towards her hip to create more space. My right hand is doing a anterior to posterior femoral glide. It's not real strong right now. It's probably like grade 2. Bob is doing a grade 3 or so, or depth.
Yeah, 50% into resistance,
Yeah.
if you want to call it that. Mm-hmm.
Into compression. And then, hopefully, there we go. And then we're just following that direct line that continues to change as the joint is learning how to sit better into the acetabulum. There we go.
So what you guys can't see, because it's sort of unsolvable, is she's starting to internally rotate and set underneath the socket. I can feel that pretty nicely on mine. And Kat, because we paid you off, you're going to say the same, right?
I feel fantastic.
There we go. And then the other thing that I really would want to work on with her is some really strong pelvic dysfunction that I think she doesn't know that she has right now. So
I had no idea.
I don't. We'd have to actually do an exam on that. But okay, now that feels better. Can you lengthen that out now? There we go. That's really good. Lengthening. Good. Does that hurt anything?
Actually, it feels good.
Feels good? Okay, good. So then we're gonna go a little bit more aggressively. So he's gonna create space so that I can push the femur down, okay?
Don't pull me off the table.
So, yeah.
Push me down. There you go.
So he's creating space. I'm gonna get on femur and just do a little oscillation to go anterior to posterior while he's creating space in there. Think about relaxing the front of your hip and think about relaxing the back of your hip so it's got some place to move into. There we go. Nice. Okay. All right, and then, that's a pretty nice difference for those of you who can see that, right? So, and that's me stabilizing, not letting her compensate at all. If I let her compensate, she'd get her leg all the way to there. Okay, so I would expect my range of motion to be different after that too, right? But before I check range of motion, I really would like to do an inferior glide. Because we just worked on this side, I'm actually gonna have you turn head up this way facing them. On your side. Yep. And lift your head up, like so. Bend the bottom leg up, bottom leg up, there you go. Hold there, great. And then, so, relax that. So, she looks like she's lifting her leg a lot higher, and you should all say, wow, but she's completely compensating. So, let's get her not compensating first. There we go. Okay, so from here, that still is pretty impressive difference. And now, so MCP is going to go posterior and inferior. I already did posterior, right? Anterior to posterior. However, when I get her in this different position on her side, can you relax your leg? Thank you. Go. When I get her in that different position, it just loads up differently and it pulls forward, which is why I think she still has a little bit more lower abdominal, like inguinal ligament area restriction, which is pulling that. So, all right, so from here, I'm going to go inferior. Does it feel okay? This leg is lifting up to create tension to her pubic rami, all the way down long adductors, plus her short adductors. I can then, oh, she's got some great restriction. By great restriction, I mean yummy for a therapist, right? Oh, I want after that restriction there. Ooh, is that tickly?
Yes.
Sorry. And may I touch the bone that you sit on?
Sure.
The sit bone? Okay, so her sit bone, which is right here, if I trace that, oh, so her hamstring on the backside is really restricted. Her adductors, Lord have mercy, do they need some work? There we go. And then you can see just from doing that, I'm lengthening this, I'm shortening this, and I'm doing an inferior glide of that femur. There we go. Now I'm not doing what we call muscle energy technique here, but I'm just taking her to her end range and saying, hey, adductors, you guys probably haven't worked here for a really long time. Let's work you here. You'll notice that when she pushes, this hand is going to want to pop up. So I'm not going to let it pop up. I'm going to keep it down. Okay, so very gently take your knee and pull it into my leg. There you go. And then I have to sink into that a little bit more, which increases my capsule direct restriction mobilization. Good. And relax. There we go. Taking that up a little more. Woo. Okay. So again, she's somebody, that's pretty nice. She's somebody who would respond really, really well to coming in every now and then for some maintenance treatment, right? Maintenance therapy gets such a bad rap. Everybody needs it. You take your car in, why don't you take your body in? Right? Take your teeth in twice a year. Why don't you take your body in? So maintenance is good. Other side, and then we're done. And I'll show you how we do it way faster on this other side. Okay. Other side. Bend that bottom leg. Yep, keep it right there. That hand pulled on. Good. I'm not sweating with all of my patients. So I'm sweating a little bit now, just because it's hot. All right, ready? So again, the last time was pretty gentle, because I was assessing that that's what her tissues were going to respond better to. Of this side, can you let that part release? Thank you. Good. Pull down and release. Don't pull your abdomen down, pull your knee down. There you go, and release. Good, pull down, and release. Pull, and release. And then Other thing too is, you know, you guys, I'm assuming are thinking, wow, she's touching her pelvis a lot. And we do, and that's because, even though she's not quote unquote a women's health therapist, that's where your hamstring's attached. So if you aren't touching the pubic bones, you aren't touching the actual insertion of just basic muscles. I'm not even talking like piriformis or levator ani. I'm just talking regular leg muscles, right? So make sure that you guys are, if you're not comfy with it, you know, talk to someone who's a little bit more experienced about what's the language that I can use with my patients that'll make it so that I'm less awkward, so they'll feel less awkward. Okay. I think we're good then. And then AP, lie on your back. Okay, so here's for pubic symphysis with my left hand. I'm going to stay superior to that. I know that I want to get inferior to the umbilicus. And if you just look at my forearm, I'm coming around the corner. There's my guy, my gal, your gal. There we go. So now, I'm gonna start using, I love physics. I don't remember which lever this is, but I'm gonna use it. Anyone? Any students here? There's a student. You were in. One who's from, yes. Which lever? He's like, I don't remember. Extra credit points for anyone who knows. Okay, good. Now, take your tailbone, pull it down towards the ground. Good, and release. Good, take your tailbone, pull it down towards the ground. And release. Good, relax your abdomen if you can. Thank you. Do a little bit more there. Good, and pull down one more time. Excellent, and release. Nice, okay. Now stand back. Okay, so we haven't done the elbow flexion one, so let's go back to that one and see how she does. Just bend your elbows, just relax. Okay, and then don't let me straighten your elbows. Okay, so that's pretty nice. Now, I'm not happy with the fact that her elbows straighten, but she didn't fall over, and I'm not cueing her to do anything different, right? I said the exact same thing before. Don't let me straighten your elbows. So she's thinking about her elbows. She's not thinking about abdominal bracing. I've got to make sure that my foot is on, you know, between my ball of my foot and my heel. I don't know, right? It's don't let me straighten your elbows. Right? I can fall on top of her almost. Almost. Relax for a second. Good. Bring your right leg in front. Don't let me straighten. So relax for a second. Okay. So yeah. Whoa. Okay. You're good. Okay. Don't let me push you over. Don't let me push you over. Okay. So that one is not better right now for sure. Can you relax this area? Good. Good. Back up. Just relax. Good. Don't let me push you over. Okay. And hold on, I pull you. That one was still fine. Other side. Don't let me push you. Good. And don't let me pull you. All those are looking much better. Except for that.
You gotta leave something for me.
I know. Hold up here. Don't let me pull you down. Now look at that difference, you guys. That's impressive. Hold on, let me move you. She's someone who's got pain who gets in and out of a car. She has problems doing stairs. That is really substantial for her. Come back up. Hold on, let me move you. Nice. Relax. Let's relax. We're going to look at internal, external rotation. We'll start with the right. Okay, she's kicking her other leg now, and this isn't popping up at all. Internal rotation. That's really nice. External. Again, moving her other leg out of the way. Relax. There we go. She still pops up a little bit right there. But again, we're at 40 degrees or so, 30 degrees. We'll take that. Lie on your, actually no, let's do extension. Lie on your stomach. And I didn't even treat out innominate extension, which shoulda, coulda, woulda, just didn't. So let's see if that's any different. It's substantially different. So 1, 2, this finger should move upwards, right? And it does. I don't need to check the other one.
So here's an interesting point. So Kat, do you mind hanging out here for sake of time? Because we could easily make this into an all-day event,
Oh, sure.
but we can't. So we have to eat. Do you mind being the participant for the rest of it?
Sure.
Now, in our world, the marriage of manual therapy and motor control, that was the manual therapy. You guys get pretty appreciative of how much better she's moving. Now, if we send her off, she might be a lot better. She's moving more efficiently, but is she moving is the best control? Now, if you followed April around, she would do something after this. Because I'm also a speaker here, I'm going to do my thing after it on Cat. You don't mind, do you?
No.
Come on back up.
It's $300.
Deal, man. We're going to pay you $400. So we're going to go through, and Kat is already in lab clothes, which is fantastic. And April's going to chime in a little from time to time, but we're trying to see what is an MSI approach, what is a movement control approach, address this patient who's just gotten a lot more mobile. Because if we have mobility, it's like turning that rudder on a boat, we're headed back to course. Now for the wind, if we were to put the wind in that sail, it may not be back at course. So we're trying to look at putting the wind back into that sail and move it along. Sound good? Come on back up. So what do you guys see during the motion examination, any part of the examination that still is not comfortable in your stomach? Like, wow, April is really cool, she did a lot of great stuff, she's moving a lot better. But what thing is still interesting? Yes?
I'm worried about the learning effect, and now we tested her 3 times on the same thing, and she's getting better each time with
Absolutely.
that effect of learning.
So I could while you guys was doing the same test, or I could do some different tests. So let's do some different tests. Let's see here. So in the MSI approach, we would look at her still as an extension. Now April did anterior posterior, she improved her hip, things are stacking better on top of it based on how she's much more strong with strength response. But as the learning effect, how do we hold on to this? All right, so how you feel right now?
Pretty good.
All right, any discomfort in that back or hip areas other than just kind of gotten worked over?
No.
All right, let's look at her appearance. Do you mind facing me? So you mind if I expose you a little bit? I won't expose your tailbone though, I promise.
Bob, side note, I still want to do lumbar extension at some point to check and see what changed, and I'm assuming that's.
That's what we do. I'll be doing that in a moment, yeah. So before we do anything, we're just going to look at her mobility. You good with that?
Mm-hmm.
And you don't mind if I pull these guys up above your knees?
No.
So in an appearance, and in the handout, it's there. So let's just look at, relax yourself for a moment. Let's just look at what we're looking at here. Let's look at what we're looking at. So we're probably looking at maybe a little bit more extension, lordosis there. If I palpate, maybe a little bit more tone or contractility there. How about her hips? Her one hip a little bit outwardly rotated than the other. Are these inside both of their hips? Are they symmetrical? You see that? So like this part here, is she rotating a little bit more? Is she more on one leg than the other? Which one? Okay, so let's do this. Let's go ahead and flex forward again. Just bend forward. Let's just look at forward bending there. Come on back up. Alright, one more time and we're just going to hang out there if you can. So again, that curve reversal is a good bit better from April's motion, but it still maybe could be a little bit better, after just a few minutes of treatment. Come on back up. Any pain with that?
Yeah, a little bit.
Whereabouts? Is that your familiar pain?
Yeah.
Put your hands in the small of your back and just bend backwards. Okay. And that's a little bit better, April. Come on back. How does that feel?
That feels okay.
Okay, and no discomfort with that one. Okay. All right, let's look at side bending. Go ahead and bend to the right here. What do you guys think about that? Pretty flat. It doesn't take. It kind of takes the load maybe here, and then you go to the other side, which is our better side. This side curves better to the left. The right side, it looks like it's a little less stiff. Is one side more uncomfortable than the other?
No, it is.
Which side is more uncomfortable, the right or the left there? Going to the right or going to the left?
More uncomfortable on this. Or no, this is.
Going to the right.
Yeah.
Okay, good. You're going to keep your $300 check it. Alright, let's cross your arms and twist to the right. What do you guys think about that? And then back. Can you focus in on her from here? Okay. And then to the left. And then to the right again. That's an interesting little catchy thingy. Alright. So we've got an idea of what's going on. Let's go lift up this left leg. See what happens in the hip drop. And then back. And then the other leg. and then back. So one more time. Which one's more cattywampus looking? And then the other one? We're looking for kind of bigger stuff. So when she's standing on the right side, it's a little bit more interesting.
Is she watching herself?
What's that?
Is she watching herself?
She's watching herself, I guess. All right, excellent. So let's decide which is our most interesting dysfunction of those bunches. How are you feeling right now? What's that? Side bending? Side bending. Oh, side bending to the right side. So you don't mind, we're gonna leave this up here. So let's kind of take the approach. We're gonna treat what she fails at here. So let's go to the right again. All right. Give me a pain rating, or you could look at range of motion. She's above her, about an inch above her thing. Come on back, and then she does this sort of interesting torquing. So come on back. So now April did not do her thoracic spine. If she did, she'd probably be moving easier from a manual therapy point of view. So from a MSI point of view, let's stop where she's moving, which is probably here. And that's kind of where her symptoms live. Is that right? So I'm going to stop where she moves. I'm just going to give a nice big bear hug. So movement systems impairment therapists do manual therapy. We do put our hands on people. Let's go ahead and move to the right. Just go ahead. Yeah. Yeah. So I'm going to block where it hurts. And come on back up. And again, you guys seeing it? Okay up there. Go ahead again.
On the other side?
No, just to the right. That's the dysfunctional side. And then back. If we had little glow-in-the-dark markers, that'd be nice. Go ahead again. Good. Let's do about 3 more. This is a movement thing. So if this is important for her, this would be her exercise. How would she block herself? Symptom, or her hip, that's a little different story. Maybe wedge against something so she could use that to move more freely. One more time. I can't count. I'm a physical therapist. Very good. How are you feeling right now?
Okay.
Ramping up at all, or is that more your thoracic spine? That's
No, I still have something.
okay. That's for our other class next year. She has to come back for the next one. All right, so let's repeat. See what happens. Go ahead and move to the right then again. How's that feel?
A little better.
Okay. And then back. One more time. Let's look at, no, just to the right.
Oh, I'm sorry.
So she got a little bit more motion, and she's not torquing there. So that's an important thing for her. All right, how about the standing? Go ahead and lift up your left leg there. Or, yeah, left leg. Does that change at all? It might, because she has a little bit more mobility. Come on back. Now let's do this for me. I'm going to put my hands in your belly. Is that okay? Tighten these guys a little bit. Just give me a little tight. Right here and here. I'm asking her obliques to come on to stabilize her pelvis. Good. Now she just flattened her spine out, which is interesting. Now back to April's comment about, do we do this constantly? Well, no. You have to build up the passive stiffness over time. She's got a lot of length up in here. She needs to get these guys toned up. So tighten this up a little. Good. Now lift up your left leg. And then down. I'm giving her a lot of feedback with my hands in the wrong place, but this is what I want to do. Tighten this one up. So tighten it. Good. And I'll lift up the leg. And then better. Good. And then tighten it again. And lift up the left leg. Now how does that feel that way versus don't tighten it, just do your normal way?
I feel more of a stress function.
With what? With or without?
Without.
So with you have a little bit more stability there.
Right.
Now if I'm running out of time because the lecture